Assalamu alaikum. Today's article is titled Post-Operative Pain After Ultrasonically and Laser Activated Irrigation During Root Canal Treatment. It's a randomized clinical trial conducted by a Belgium group. A frequent short-term complication of root canal treatment is the occurrence of post-operative pain, which mostly appears 24 hours after treatment and generally recedes within 48 hours. And irrigation with a syringe and needle remains the most commonly used technique for irrigation in endodontics. However, the fluid penetration at the apical region is limited. So the use of ultrasonically activated irrigation or laser activated irrigation or other method is advocated. And because irrigant extrusion may lead to a higher incidence and or degree of postoperative pain, and because the powerful irrigant dynamics observed with laser activated irrigation raised concerns about extrusion, the purpose of this randomized controlled trial was to compare the postoperative pain after ultrasonically and laser activated irrigation in asymptomatic patients undergoing primary root canal treatment. For the materials and methods, the study subjects were recruited from the outpatient clinic of the Department of Endodontology of Ghent University Hospital between March 2019 and March 2020. A sample size of 25 patients in each group was estimated, and the eligibility criteria were healthy patients over the age of 18 years who required root canal treatment of an asymptomatic tooth with vital or necrotic pulp, or with a previously initiated therapy on the emergency dental department. With or without radiographic apical radiolucency, they were considered for enrollment. After clinical and radiographic examination, each patient was asked to determine the level of postoperative pain by drawing a line on VAS, which is from 0 to 100 millimeter, with 0 meaning no pain and 100 meaning unbearable pain. And for the endodontic procedure, a complete chemomechanical preparation and the canal filling were performed by the same operator in a single visit. The canal preparation was completed using ProTaper Next rotary files. And for the randomization and blinding, patients were then randomly assigned to one of the two groups based on the supplementary irrigation protocol. Group A received ultrasonic activated irrigation and Group B received laser activated irrigation. And for the allocations, it were concealed using opaque sealed envelopes containing the randomized group name, A or P, and the unique randomization code for every subject enrolled in the study. And then for the intervention, prior to the final irrigation and after instrumentation, the root canals and the bulb chamber were filled with 3% sodium hypochlorite. In the ultrasonic activated group, the ultrasonic was activated for 3 cycles, 20 seconds each. And for the laser activated group, the laser tip was held above the root canal entrance, and 2 activation cycles of 30 seconds were done per canal. Of course, with an intermediate rinse with 2 ml 3% sodium hypochlorite. And then the canals were dried and filled with gutta percha using the continuous wave compaction technique with AH plus sealer. And post-operatively, each patient received a pain diary to record their pain on the following moments: 6, 24, 48, and 72 hours after the intervention. And the visual analog scale from 0 to 100 millimeter was used to indicate the pain intensity. The pain diary also contained a part to keep a record for their analgesic intake as well. And for the result, a total of 88 subjects were initially screened for inclusion and 56 patients were finally enrolled in the study. The random allocation resulted in 28 patients in the ultrasonic activated group and 28 patients in the laser activated group. 55 patients returned their VAS form. 1 patient from the ultrasonic activated group failed to do so. And for the mean postoperative pain intensity, it was low, with the majority of patients having no or minimal pain 24-hour postoperatively for both groups. And 6-hour postoperatively, pain intensity was significantly lower in the laser activated group compared to the ultrasonic activated group. And at 24, 48, and 72 hours, no statistically significant difference between the activation groups were observed. And for the evolution of postoperative pain over time, in the ultrasonic activated group, the pain at 24 hours was significantly lower than the pain at 6 hours, and at 48 and 72 hours, the pain levels were significantly lower compared with the preceding time interval. In the laser-activated group, the mean postoperative pain score at 24 hours was slightly higher than that at 6 hours, but this difference was not significant. And at 48 and 72 hours, a further significant decrease compared to the previous time points was also noted. And one patient from the ultrasonic activated group reported severe pain up to 78 millimeter on the VAS till 48 hours postoperatively. This case was associated neither with swelling nor with an emergency visit. And for the incidence of pain 6, 24, 48, and 72 hours following root canal treatment based on the following distribution of the VAS scores, either absence of pain when it's from 0 to 4 millimeter, presence of pain when it's more than 4 millimeter on the VAS scale. At 6 hours postoperatively, pain incidence in the ultrasonic activated group was 62.9%. This value was significantly higher than that in the laser activated group. And the logistic regression analysis of the incidence of postoperative pain revealed a significant association between the presence of postoperative pain at 6 hours and the final irrigation protocol, whilst no association was observed with age, gender, tooth type, and the presence of radiolucency postoperatively. The 6 hours after treatment, 26% of the patients in the ultrasonic activated group and 7% of the patients in the laser activated group required analgesic for pain control, but this difference was not significant, and no significant difference in analgesic intake between the two groups were found at the time interval. So to conclude the findings of this randomized clinical trial, it demonstrated no clinically relevant differences in postoperative pain after ultrasonically or laser-activated irrigation in asymptomatic patients receiving primary root canal treatment, and the levels of postoperative pain were low, and neither of the activation methods resulted in any adverse effects.